3 million people have died from the coronavirus. Most of the victims in the United States and Brazil. But there's hope. Half all Americans have received their first vaccination. Half all Israelis have received 2 jabs. Life for them is returning to normal. But mutations could change that if they find a way to evade our body's immune response.
The World Health Organization warns cases in many countries are still rising at an alarming rate. Some other nations are confident they're over the worst. Our correspondent Tania Krämer reports from Israel, where a rapid vaccination program has brought with it some welcome freedoms.
They're taking it easy at this outdoor cafe in the center of Tel Aviv. There's a sense that life is gradually returning to normal. The government has rolled back many restrictions. Owner Stav Blecher is cautiously optimistic. We have the feeling that it's over. It's nice, it's a relief. I feel the virus is no longer a threat as everyone here has been vaccinated. Chalas, enough already. Look, even my mask had enough. Case numbers in Israel have fallen sharply, thanks to one of the world's fastest vaccination drives. Some restrictions remain, such as wearing masks, and a Green Pass vaccination certificate is required in some venues. After 3 hard lockdowns, people are not taking things for granted. It's great that things are getting back to normal. Of course, I'm still wearing a mask. We are cautious, there's still fear. You can't shake it off that quickly. Over half of the population of 9 million Israelis has been fully vaccinated. But Israel has been criticized for failing to supply vaccines to more Palestinians in the occupied West Bank and Gaza. A COVID-19 unit in a converted parking lot at Sheba Hospital near Tel Aviv was closed recently. Public debate has now turned to vaccinating children under 16, the threat of new variants, and how long the vaccines will offer protection.
Going back to school and back to commerce, people are back in workplaces and are vaccinated, and we see a decline in cases. So people are generally very optimistic. Of course, the science is a little bit more cautious, and we have to be very careful in assessing new variants and in looking carefully at the vaccine effectiveness.
To keep variants at bay, travel restrictions are still in place, as here at Ben Gurion Airport. Foreigners need a special permit to enter. Only by late May, small groups of vaccinated tourists will be allowed in. For now, Israelis are enjoying their newfound freedom. The pandemic is far from over, but at least in the bubble of Tel Aviv, it almost feels like it could be.
Eyal Lesham, who was in that report there, joins us from Tel Aviv. He's a director at Israel's largest hospital, the Sheba Medical Center. Just how close is Israel to the end of the pandemic, would you say?
Well, by all means, Israel is seeing a substantial decline in the number of cases. However, we're not at the end of the pandemic. There are still limitations on travel, and obviously there is risk for resurgence of the disease for a number of reasons.
And you've still got a lot of Palestinians to get vaccinated.
Well, the Palestinians that work inside Israel were offered vaccines, and many thousands of them were vaccinated. From what I understand, and I'm not a specialist in international law, the Palestinian Authority has a jurisdiction on health provisions for the residents of the Palestinian Authority. However, as a doctor and a person, I think Israel should do anything in its power to help the Palestinian Authority vaccinate the population as soon as possible.
There are others who argue it's Israel's responsibility, and at the same time, I mean, what's the point of getting Israel vaccinated or Israelis vaccinated when its neighbours are not, and there's a to and fro of people, of course, in that region. And we're also talking about a globalized world here. What's the use of the country getting vaccinated when other countries haven't even begun?
Well, I fully agree that while this is a globalized world and there are many connections between populations, countries need to support each other and try and achieve the highest vaccine coverage globally and not only in specific countries. However, health inequities are not a new issue or topic in global health. There are many health inequities between the Europeans and the African countries, for example, and this is only just one specific example of how health inequities impact the global population.
So from your scientific perspective, how should Israel proceed to ensure that all of the progress it's made, which is fantastic, isn't undone?
Well, one subject that needs strengthening is surveillance. We need to continue looking for breakthrough cases and outbreaks and try and contain them through classic public health measures such as quarantine and isolation. We need to make sure that people who enter Israel from abroad get tested for COVID and do not risk the population by inserting the virus back into Israel. And of course, as I mentioned, we need to support the global effort to lower the risk and eliminate the virus eventually.
You said in that report we have to be very careful in assessing new variants and the effectiveness and duration of vaccines. There's a new study which hasn't yet been peer-reviewed, but it shows a small amount of fully vaccinated people can get infected with the variant first discovered in South Africa. Is that, or could we perceive that as the first evidence that vaccines may not work against some mutations?
Well, we have indirect evidence that support lower effectiveness of some of the vaccines against some of the variants of concern, including the variant that was identified in South Africa. We don't have evidence to support that the vaccines have substantially lower clinical effectiveness. So in simple words, it may be that the vaccines still prevent severe disease, hospitalization, and death from caused by these variants. So vaccinated people are protected, but perhaps the efficacy against transmission and mild infections is lower for some of the variants. The solution is A, obtain as much data as possible by surveillance, and B, prepare the contingency plan by possible changes to the vaccine induced antibodies so that they fit new variants, and perhaps booster doses for those fully vaccinated.
Well, Israel is considered a world champion in surveillance as well, but this study suggests mutations keep finding ways to evade the body's immune response. How can we deal with that danger posed by new mutations then?
Yeah, so again, some fine-tuning. We are talking about infection. There is no evidence that these fully vaccinated people who were infected did have a severe disease. So the vaccine may still protect the body against severe disease, which is the primary objective of vaccine. We don't want someone to be severely ill, but they may still be infected. And the only way that we can control such immune evasion against infection is to develop vaccines that are specifically more effective against these variants of concern, while maintaining the public health classic measures of isolation and quarantine if we see an outbreak of this type of variant of concern.
Eyal Leshem, the director of the Center for Travel Medicine and Tropical Diseases. Thank you very much for joining us today. And over now to our science correspondent, Derek Williams, who has an interesting viewer question today about COVID and vegetarians.
Do vegetarians and vegans get less sick if they catch COVID-19?
I was surprised at first at how little clear data I could find on this topic, but I guess I shouldn't have been. I mean, what constitutes a healthy diet, after all, has always been controversial, but I can say that I found no reliable studies establishing any direct links between diet and COVID severity. What I mean by that is that no new evidence in the course of the pandemic has, for example, caused the World Health Organization to change its dietary recommendations. although the WHO certainly emphasizes the central role that fresh produce plays in a healthy diet, it also continues to recommend the consumption of certain animal-based products as good sources of protein. That said, indirect links to diet have been established because while eating mostly unprocessed plant-based products doesn't guarantee perfect health, many studies have shown that it does help reduce non-communicable diseases like obesity or type 2 diabetes. And those conditions are unquestionably risk factors for developing a more severe case of COVID-19 if you're infected. So the takeaway, I guess, is that there's no evidence that eating the occasional burger raises your risk of contracting severe COVID-19. But putting on a lot of weight by eating too many burgers over too many years does.
And while on the subject, some good news for diners of fine food. Sometime back, we brought you the story of Alexandre Matzia and how his top restaurant in Marseille was doing takeaway for the first time and had set up a food truck. Well, here it is. Just a few meters from the restaurant where most of the food is prepared. Matzia has 3 Michelin stars to his name, so the homemade lunch he and his team whip up is pretty pricey, between 22 and 36 euros. But demand has been strong enough for the chef to call back all of his 17 employees to the kitchen. Nice to hear. Thanks for watching, stay safe, and see you again soon.